EQUIPP Copilot is really helping. Like it works hand in hand with us. In our workflow, there is no extra work, to be honest, meaning software does most of the things itself. And whenever we open any profile or we type a new prescription, then it starts working and loading on the side. It will pop up. It will give us like a small number, one, number two, or the patient initials. Let's say if it is John Doe, it will just say like JD sometimes. So we understand that okay, the Copilot is suggesting something at this point. So that's a really nice pop-up. We really like that. We don't have to go separately, or we don't even have to remember that okay, let's check this patient in our patient adherence program. No, program reminds us to work on this patient, and then integrate if there is any opportunities available, or if there is any documents to be submitted, something like that.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Anthony, thank you so much for joining us today. Let's start by just learning a little bit more about you. Tell us who you are, what's your role, the pharmacy you work for, and give us just a little bit of insight into more about your pharmacy. Where's it located? How busy are you? How large is your staff? How many patients are you serving? So just give us an intro into you and to your pharmacy.
All right. Thanks for having me. My name is Anthony. I work in King's Pharmacy. Nice to meet you, Emily. I work in Brooklyn, where pharmacy is located across the Kings County Hospital. And we have about 12 to 13 people staff, and like 6 to 7 pharmacy staff, and the front staff is separate. Especially the staff inside the pharmacy, they are mainly educated for patient counseling. As if they have any more questions or additional clinical questions, the pharmacists jump in. Otherwise, they would handle it at the time of pickup, and or maybe drop off of the prescriptions whenever any patients want. We do about 30 to 35 patients counseling, I would say, per week. And out of that, only few of them has additional questions. Otherwise, there's normal questions like what is this medication for, how many refills, blah blah blah.
Yeah, perfect. Thank you, Anthony. How many scripts would you say that your pharmacy is filling a week then?
I would say about 1,200 to 1,500 scripts per week.
Okay, so that's a pretty busy pharmacy. And I really appreciate your thought process around kind of separating some of the duties. And it sounds to me like you've taken an opportunity to empower parts of your staff or persons within your staff to do some initial points of clinical consultation at the pickup and drop off window. Is that right?
Yes, that's correct. Absolutely. Most of the talking to patients happens at the pickup counter, or if not, sometimes they call, and it happens over the phone as well. And we provide delivery services. If any patient has question at that point, they have to call us back, and pharmacist interacts with them later on.
Fantastic. And can you give us a bit of an insight into how have you trained those staff members to handle those consultation questions and touch points with your patients?
Yes. So to keep it short, I would say our staff is trained when the challenges comes, and when like everyday work, our workflow is set up in a way that uh, we try to call patient as soon as the bag is ready. So patient's first questions will be like, what is it for? I just have got this medication, or I'm not ready for refills. So then we try to educate, or if the person over the phone, he will be like, oh no, this is your blood pressure medication, you have to take it, you cannot miss it. Or if it is something else for cholesterol medicine, if something is doctor has changed, so they at that point the conversation happens. Mainly everybody learn with their experience. Our staff is pretty old here, I would say maybe between 10 to 20 years. Everyone stayed. So they learn from their experience. We don't have to teach them much. And they remember most of the patients. So then they know how patient is expecting from them. They know how to talk to each other. And also patients are taking medications from years, so they already know what it is for.
Fantastic. Okay, Anthony, I'm going to summarize really quickly here. I think you gave us a lot of really helpful nuggets already in the introduction part. So, what I hear is it takes a team-based approach. Doing training and support for your team members has been part of the success that your pharmacy has been able to recognize. So, training them to do those touch points of medication consultation, helping to describe to your patients the why it's important for them to follow up and take these medications. And also, you've created a really fantastic culture and environment to work in. So kudos to you and the King's Pharmacy team. That's fantastic.
Thank
Now,
you.
yeah, you mentioned workflow. So you've got all of these staff members that are oriented to address certain parts of the pharmacy's just kind of natural workflow. And sounds to me like you are already working on your success with some of the payer sponsored adherence monitoring programs. And one in particular that you're participating in has allowed you to adopt some additional or new technology within your pharmacy's workflow. So I wanted to open up a conversation around. Essentially, there's a lot of different pharmacy software programs out there. You have a lot of competing priorities in the pharmacy. How have you been able to successfully integrate this new technology that you have, which is the EQUIPP Copilot, sponsored by one of the health plans that you are participating with? How have you adopted that into your workflow? And if you have any specifics on how that has potentially impacted your day to day, we would love to hear a little bit more.
Okay, yes. As the name says, Copilot, EQUIPP Copilot is really helping. Like it works hand in hand with us in our workflow. There is no extra work, to be honest, meaning software does most of the things itself. And whenever we open any profile or we type a new prescription, then it starts working and loading on the side. It will pop up. It will give us like a small number, one, number two, or the patient initials. Let's say if it is John Doe, it will just say like JD sometimes. So we understand that okay, the Copilot is suggesting something at this point. So that's a really nice pop-up. We really like that. We don't have to go separately, or we don't even have to remember that okay, let's check this patient in our patient adherence program. No, program reminds us to work on this patient, and then integrate if there is any opportunities available, or if there is any documents to be submitted, something like that. On top of that, when I learned more about this program, I came across two options, like enhanced, I would say enhanced functions services for controlling blood pressure, and the other one is LAMP, uh, which is like longitudinal adherence monitoring program. Um, I'm going to talk about the second one later on, but the first one, I would say that in our pharmacy, particularly, we have a blood pressure monitoring chair. So patients, it's completely free. They can just come, sit, they can measure their blood pressure, and if they have any questions, if they are going through something, they can talk to pharmacist. And as I said, we are right across the hospital, so we can recommend them to go to emergency room or something if there is serious situation.
Fantastic. Okay, so sounds like the Copilot has been really instrumental in helping to provide some efficiencies in the workflow that you already had with this great subset of employees within your pharmacy. The pop-up happens, you understand the alerts that are available and opportunities that are available for the patient while you're filling a prescription for them. So thanks for walking us through how that's impacted your day-to-day and your pharmacy workflow. Okay, so Anthony, since the Copilot is just an overlay on top of your pharmacy management system, tell us a little bit more about the ease of use and how quickly you and your staff are able to access the features and functionality of it.
Yes. So the biller, typer, and the pharmacist, they can check that this Copilot installed on everybody's computer. It's completely free and user friendly. They don't have to really check anything. As I said, that's the Copilot will jump in or pop up and show as a reminder that this patient has some opportunities available, and we didn't have to really do much. It's only the new additional thing I would say we have to be a little bit tacky about it, that okay, how the program works. And it is very efficient and user friendly, so we can always download the patient list. We can see through the graphs available, charts available on the dashboard. We can always focus on the low numbers and then bring it up high, and then that way we can complete our opportunities and documentation.
Yeah, that's fantastic. So I think you noted a couple of really cool features about the Copilot. And one is, as we've talked about, this overlay for enhanced services opportunities where whether it's the adherence monitoring program, controlling blood pressure, you're able to interact with those patients at the point of care, do your documentation within this flyout. But as you just noted, Anthony, you also have the same capability that you have in the EQUIPP web app, where you can see all of the patient lists, you can download those lists, because sometimes that's more helpful if you're engaging lots of folks within your staff like you are to work on some of these clinical care opportunities. Yeah, so of the features within the Copilot that we just talked about, let's dive in just a little bit more around the documentation feature. When you have patients that have opportunities for enhanced services, tell us a little bit about the utilization of that documentation feature. Is it intuitive? Do you feel like that's allowing you to participate more in these payer-sponsored programs? And is it helpful with the visibility into revenue that documentation tool provides to you through the Copilot?
So yes, it has enhanced services, and it's easy to use. As we can click on the opportunities. Let's say any diabetes patient has any opportunity, we can click on it, and we go to the next page. It shows us the list of patients, and when we click on the patient or maybe start documentation, the opportunity, it will remind us, or it will give us the options like how did we reach out to the patient. So it's very like few clicks away, and when we finish it, we can save it. I'm not sure how often this software updates, but I would say it's everything is online and integrated, so within a week or so it should give us the reports back. I just had a question about that. Do you know how often the data loads once we finish our opportunity?
That's a fantastic question. So the EQUIPP data reloads every week on Friday. So always look on Fridays to see if you have additional or new enhanced services opportunities. For lots of payer programs, you'll also see updated patient level information, so updated adherence scores, so that you can continue to track and trend the progress and improvement that you're seeing at a patient level compared to those interventions and outreaches that you're making? So it's a great question.
Right. Yes. Thank you for answering.
Yeah.
Uh, yeah. Besides that, I love it. I've been completing my opportunities, and as I said, it's very easy to use. Like only few, I would say 5 to 10 clicks, and we can finish any task given over there.
Fantastic. Well, we are so excited that this Copilot has been able to provide you and your pharmacies with a more efficient and optimized workflow process so that you can continue to earn revenue from these payer-sponsored programs. I have one more question for you, Anthony. Now that you've seen the power of the EQUIPP Copilot, What else do you think it could solve for you? Do you have any thoughts on enhancements or other functionalities that would be nice to live within the Copilot?
Right. So apart from the features that are already there, I would say one, since everybody is going to AI and automation of every software, so I would say one automation or two automation reporting tools, actually, so we can get reports or reminder every week or every bi-weekly that okay, this many we have like 20 patients last week and now only 4 patients left out of my list, and those patients I can work on following week or this week. A second auto reminders could have been for patients just to remind them regarding their adherence, how they keep taking medications, or their refills are ready, or they are due for refill. Some kind of reminders if patients also get. Then once we come across that patient, and once we counsel them, it will be easier for them to for us to educate them. And lastly, I would say third feature I would expect if they can add is the refill reminder or refill request message, or I would say a fax if it can go to the doctor office from there, because we do it from the pharmacy software, but as I just said, like there is a note section available when we send the refill remind request to the doctor. So I don't know how they see it from their end. If they can get a fax or some message on pop up on their end, that would be great.
Anthony, those are fantastic suggestions. All capabilities that we have within the Copilot to build upon for sure. And I really love and want to hone in on the second one that you mentioned, because what you're doing to improve the quality of care for the patients that you serve, whether it's taking a blood pressure or counseling that patient after they've sat, in your automated blood pressure machine, whether it's talking through medication adherence and what their regimen looks like for maintaining their adherence status, et cetera. It's all around patient behavior, and you have to change that. That's what you're really working to do, and that's certainly not easy. So ways that the Copilot can help you generate easier messages or more consumable messages by your patients, I think, is a really fantastic idea. So we'll look forward to getting started on those features and enhancements really soon. Anthony, thank you so much for your time. If you had one tip or piece of advice that you would share with any of your peers out there that are thinking about utilizing the EQUIPP Copilot or digging into payer-sponsored programs, what piece of advice would you give them?
Yeah, I have two small advices for my peer pharmacists that everybody knows that's like a lot of insurances or reimbursements went down for most of the medications. This is an extra benefit as a reimbursement wise or extra revenue wise. We should take it. It gives both pharmacy and the patient benefit of patient therapy management and extra reimbursement per prescription. And it's not time consuming. There is no extra work. It's keep happening in the back end and side by side with your computer system. And that's it. I would say just keep us one BP monitor for any patient to just come and measure for it, and then you can submit the data, and then you just get some reimbursement for yourself. Yeah.
That's fantastic.
Yes.
Easy as that. That's right. Anthony, thank you very much for sharing your story with us today. We appreciate all that you're doing and all that you do for the patients that you serve. Take care. Thank you.
Thank you very much. Likewise.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.